नमस्कार. गजालीच्या आयच्या आमच्या खाशेली कार्यावळीन आमचे बरोबर आसा डॉक्टर जी किलारा, डायरेक्टर कन्सल्टंट रेडिएशन ऑन्कोलॉजी HCG हॉस्पिटल बेंगलुरू. एक अतिशय गंभीर असो विषय जो आज सबंद देशाक व्यापून ग्रासून उडयला अशें म्हणूं येता आनी तो म्हणजे कॅन्सर. कॅन्सर हे अशें दुयेंस जे आयकतकूच बरे लोक सुद्दां गरबगीत जातात. तो गरीब मनीस आसूं, श्रीमंत आसूं, कितकोय बरो आसूं, हुशार आसूं. आणि अशा ह्या दुयेंसाक आज नवे तंत्रज्ञान वाडत आसा, नवे वखदां आसात आणि ह्या दुयेंसाचेर कांय अंशी जैतूय मेळूं येता. आणि हाची वळख करून दिवपा खातीर डॉक्टर जी किलाराज आमचे बरोबर आसात. डॉक्टर नमस्कार.
नमस्कार.
बेसिकली आयचो जो विशय आसा तो थोडोसो म्हणजे रेडिएशन ऑन्कोलॉजी ह्या विशया कडेन आमी धरून उलयतले. आणि ह्या विशयान आज जी मजल गाठल्या किंवा जाचो फायदो रुग्णायतांक किंवा पेशंटांक जाता ताच्या विशीं आमकां वळख करून दितले डॉक्टर जी किलारा. डॉक्टर, when we talk about cancer as a whole, I think this is one of the disease people, whether literate, illiterate, rich or poor, everybody gets scared of when he hears he's near or dear or maybe self. But now with the changing trends in the medicines, with radiation, the scenario is changing. Still the myths persist. I'd be highly obliged if you can start with what are the myths in cancer?
I'm very glad you raised this question. Let's look at the success rate of any disease. You'll consider what was happening in tuberculosis 20, 30 years ago. Nobody wanted to say tuberculosis.
Correct.
Mental illness.
Yeah.
I used to travel by a bus which would go past the mental hospital in those days. Nobody would get off there. One stop before or one stop after. But today you don't mind saying, I have an appointment with the psychiatrist, my so-and-so is in hospital. So social attitudes determine to a very large extent what success medical science has over conquering that disease. And in terms of cancer, the first myth that I want to address is the fact that people think cancer means cancer.
Gone.
It's done, gone, you're going to die. Truth of the matter is we're all going to die.
Correct. Yes, sir.
But other truth, which is scientifically proven, is that 60% of cancers today, upwards of 60%,
Yeah.
are completely curable, which means cancer will not be the cause of death in 60 to 70% of cancer patients.
Yeah.
Compare this with diabetes, compare this with blood pressure, compare this with any other disease except the infectious diseases.
Yeah.
Where you take antibiotics, you're all right.
Correct.
Barring that, cancer today is one of the most curable diseases. So the first myth that I want to lay to rest is cancer aaya to bas ho gaya, we are finished. No, we are able to cure, that means you will not die of cancer.
Yeah.
There are lots of other myths associated with cancer. It's painful, it's, can I eat in the same plate as if I'm getting treated for cancer, can I feed my grandchildren? Very oftenly asked.
Yeah.
Is it transmitted from me to the children?
Correct.
If I take radiation, am I going to be transmitting radiation? No. You will not transmit radiation. Cancer does not spread from one person to the other person. You can eat in the same plate, sleep in the same bed. You can carry your children, grandchildren, play with them. Absolutely normal life. Cancer does not spread from one individual to the other individual. Unfortunately, the other part of this is the social implication. If somebody has cancer, let's say a lady in the house has cancer, nobody wants to marry into that house.
Correct.
And I think that's a very negative attitude, because every disease has to have a name. This disease happens to have a name called cancer.
Yeah.
Let's also look at what is medicine trying to do as a science. Somewhere we feel that if we treat, you will prolong somebody's life.
Yeah.
I don't believe that, because that is ordained by God.
Oh.
I have to go one day, you have to go one day, we don't know when.
Correct.
So the purpose of medicine is not to prolong somebody's life, but all of us, what is our wish? As long as we are on this earth, we want to be comfortable.
Yeah.
We don't want to suffer, we don't want others to suffer. Medicine's job is to try and make that dream a reality. Okay. Whether it is for 6 months, whether it is for 1 year. So people ask me many a time, so what are my chances? Is my father terminal?
Yeah.
And that's another myth, terminal.
Yeah.
And I say to them, sir, the day we are born, we are all terminal.
Absolutely, sir.
There is no, it's
Absolutely.
a reality.
We are all born with that is certain.
That is certain. That's the only certainty
That is
in
only
life.
certainty in life.
So the rest of it ought to be about the quality of our life. And for doing that, yes, cancer is a word, it's a disease. We treat it with radiation, we treat it with operation, which is called surgery, or we give them drugs specific to cancer, which is called chemotherapy.
Yes.
So these are the three
Options available.
Options available. You asked what about radiation? You introduced me as radiation oncology, so I think I'm obliged to say radiation is nothing but the use of X-rays. Previously, when X-rays were discovered, very soon they found out that these rays, they were called X because they were not known before that, they were unknown. Therefore, Konrad Röntgen in 1895, when he discovered this, it was called X-rays. And very soon they found that X-rays are a form of energy. So as they pass through tissues, they transmit that energy into tissues. All living cells can withstand some amount of energy coming from outside. But beyond a certain point, the DNA and the RNA, which are the main components for dividing of cells, they get damaged. And that is how radiation works. The X-rays, as they pass through, they deposit their energy. And if the deposition is beyond a certain limit, it kills the cells. When we say kills the cells in radiation, we mean it can't divide. And cancer, as you know, is unrestricted division of cells. So if this X-rays destroy the DNA and the RNA, then the cell is unable to divide, and that is how we control it.
Basically, yes, sir. Sir, nicely. Actually, you have touched a very good aspect of this, I should say. One is that we are not here to do longevity.
Absolutely.
I can also say that it is just like quality, how we can improve, then the quantity. Because as you have rightly said, when a senior person like you says, I think it has got more value, and I am happy that people will surely appreciate this statement of yours. Basically, doctor's role, as far as possible, is to give a quality life. And as far as his own conscious, and also as a service towards the patient, whether it may be private hospital, maybe government hospital, whatever, wherever. The purpose remains same.
Absolutely.
Correct. So, sir, I would like to know, like, how is this, you mentioned about what you mean by radiation oncology. How safe it is? Is my next, because definitely that fear is there. The rays are passing through my body or anybody's body. Definitely it will kill the normal cells also. So, possibility of other things I will be losing. That fear is there. That's afraid, they're worried about that. So, I want you to focus this on this issue.
Absolutely. There's a lot of fear about radiation. In Hindi, they call it current. They call it, Ksha Kiran, all kinds of things, which actually imply that you're burning the tissues. You're not burning the tissues. Now, you asked a very pertinent question as to, does this radiation damage the normal tissue around the tumor? If you trace what happened in radiation oncology, previously we did not have the sophistication to avoid radiation to the normal structures. Therefore, in order to kill a tumor, we were not able to give the big dose which was necessary, because the surrounding normal structures would get damaged. Over a period of time, 2 or 3 things have happened, and look at the serendipity of science. In plastic surgery, there are these fractures of the face when people fall from heights. And the plastic surgeon who reconstructed the face wanted to know from the radiology people, the CT scan people, can you give me a 3-dimensional image of the face so I know how much to move this bone by? So they came up with 3-dimensional reconstruction in CT scans.
I see.
We, on the other hand, were using square or rectangle fields for radiation, so you could only expose that. And whatever was within that would get the radiation dose. Over a period of time, we have now developed what are called micro multi-leaf collimators, which means, I'll give you an example. If you put a light to the wall and you put your fingers into that light, you can make any shape there. You ask your friend to stand nearer the wall and put his hands. Now you have 4 pairs of hands or 4 fingers like this, and you can make almost any shape that you want on the wall. So now within that rectangle or square, you put these tungsten leaves which move independently, and you can create any shape. So radiation now has the ability to create any shape. Imaging gives you what shape to create, because in 3 dimensions you can see the tumor. So now you marry the two. And now you can treat only the tumor and leave the surrounding tissues out of radiation.
So it is something like a targeted therapy.
Very targeted.
Yeah.
And there are some words which I am sure the public will hear, so I might as well say it. There is IMRT, intensity modulated radiotherapy. There is, you know that organs move.
Yeah.
So if radiation is a stationary gun,
Yeah.
but you have a moving target,
Yeah.
you might miss.
Correct.
So now you have image guided radiotherapy, where you're actually imaging where the tumor is at that particular time and then shooting your gun. So that is image guided radiotherapy.
Yeah.
So we have moved from very general kind of radiation given to a large area to very specific radiation given only to the tumor.
Yes.
And what that has resulted in is you're able to give a very large dose to the tumor, therefore you're curing more disease. At the same time, your complications of radiation are really, really low now.
Yes.
So we are now at a stage where radiation, we can unhesitatingly say, is perfectly safe. There is absolute, the other thing is, people ask, and I always tell my patients, that there is no giddiness at the end of it, you don't feel tired, fatigued, and they say, do I lose hair? If I give radiation to the head, yes, but not if I am giving radiation to somewhere else in the body.
Yeah.
The other major thing that has happened with the radiation is because we are able to give these high doses of radiation, in some cancers where we were doing major big surgery, we have reduced the surgery and giving lot of radiation. That has resulted in the concept of organ preservation or organ conservation.
I see.
So now the emphasis is, can I preserve the organ which is affected with cancer? Can I preserve the function of the organ? Classical example is breast cancer.
Yes.
Today, breast cancer in this country is the #1 cancer in women.
Yeah.
When I studied 35 years ago, we were saying cervical cancer was #1.
Yeah.
Over a period of time, because of the lifestyle, because of the late marriages, late childbirths, use of contraceptives and so on and so forth,
Yeah.
breast cancer has overtaken cervical cancer. In breast cancer, we were doing very big surgeries, mastectomies, removing the entire breast. We no longer recommend that. We just remove the lump, which is called a lumpectomy, and then we give radiation. And it's as safe. The results even at 25 years are exactly the same as we were getting with the previous ones.
Correct.
Another example is the voice box. You don't need to remove the voice box if you have cancer of the voice box.
Yeah.
Even in advanced stages, you can give chemotherapy, you can give radiation and try and conserve the larynx. Likewise for bladder cancer, likewise for prostate cancer. Several sites in the body where we are moving towards organ preservation and function preservation, which is a very major thing, all coming back to the same question of quality of life.
Correct. So basically, I'm very happy. In fact, you have mentioned very nicely that how even an organ which is moving, like say suppose which is beating or moving, that also can be this thing. Like say in a movie, sometimes we see Rajinikanth running and the villain is going with a
Yes.
good gun, but still that he cannot shoot him
jumps.
because he jumps. But I think the way you have described about this technological advance is that we can shoot him, you can target him exactly. Even the location.
Yes.
Not if you want to shoot, aim at his back or head or leg, whatever, you can do it.
Anywhere.
So definitely it is a good thing. I think I should really appreciate the way how you described it.